And I had all of these resources handed to me for what I thought was going to be maybe an 8-month journey of going through treatment. And when I got that diagnosis, I walked out with a piece of paper that basically said you were stage 4 and you were 99.99% incurable. And I had no resources. I had nothing. I had a piece of paper that said that I was incurable. For so many years, the metastatic voice was not heard. We were like put on the back shelf. And, well, you're going to die anyways, so we don't really need to be funding these types of things. Hi, my name is Lesley Glenn, and I have been living with metastatic breast cancer for a decade now. When I was first diagnosed, I was diagnosed first with stage 2B. Soon after that, I went through scans, and they found hot spots in my body, which ended up being metastatic disease to my bones. And so I was really stage 4 de novo, which means from the beginning. And when I got that diagnosis, I walked out with a piece of paper that basically said you were stage 4 and you were 99.99% incurable. And I had no resources. I had nothing. I had a piece of paper that said that I was incurable. Shortly after that, I started IV systematic chemo, and it ended up being really toxic for me. I ended up with full-blown sepsis in the hospital for a month. And after I was getting better from the sepsis, the oncologist came back to me and she said, "Okay, are you ready to go back on chemo?" And my thought was, are you kidding me? This almost killed me. And now you want me to go back on this treatment that it was actually worse than the cancer itself. So it took me to a place of really trying to pursue what I thought was what's missing in this whole dynamic of patient-doctor care. And as I started my advocacy journey and getting to know the scientific part of it and talking to researchers was, where is the patient voice in all of this? Why does our voice matter? Why is everyone running through, which I've heard the term used before, all of these shiny new toys that may be giving cancer patients, especially metastatic breast cancer patients, 1 month more without quality of life that is, taken into consideration? Because sure, we want to live longer. The statistic is that those of us with MBC only have 3.3 years. That is the statistic. I know that we're not statistics, but at the same time, there are a lot of people that are still dying from metastatic breast cancer. And we know that research is going into helping us to live longer. But we feel that, our voice is so very important. So
I was diagnosed with cancer, and I think the first few months and maybe even years were like a wind whirl. I can't remember much of what was going on through my mind. I think the biggest concern was, am I going to stay alive for it much longer? So I think one experience that I had as I was starting to navigate my treatment is that one unique thing that happened to me was that I was suffering with some specific side effects, especially my heart was being affected by the treatment that I was on. And my conversations with my doctor had to be turned to really focus on what my experience was and my needs were. And I really had to advocate for myself. And I wasn't just a data point on the clinical trial. There were many characteristics about me that were unique and that needed to be taken into account.
So when I started my organization, Project Life, which deals with the survivorship and the thrivership of those of us that are living with MBC, it was really important to me that we be studied. Like, why are there gatekeepers in these survivorship programs that are saying, I'm sorry, honey, but this is not for you. You have to be done with treatment. And then you can come and join our programs. And my question was, well, I'm never going to be done with treatment, and I deserve all of these, extras just as much as those that are done with treatment. So fast forward to, when was it? 2020, when I was introduced to Dr. Mya Roberson from Vanderbilt University through a good friend of mine. And she wanted to have the conversation about cancer care delivery with metastatic breast cancer patients and how it was very important. And what do metastatic breast cancer patients care about? What do they need? What do they want? And what is the best type of support that we can offer them? So I'd like to introduce you to Dr. Mya Roberson. And Dr. Roberson, can you share a little bit about your passion of how you came up with this project and her passion for the cancer community is amazing.
My name is Mya Roberson. I am an assistant professor of health policy at Vanderbilt University School of Medicine. My connection to cancer research is both personal and academic. I have a long family history of cancer in my family. My sister, my aunt, my grandmother were all cancer survivors. It was just something that I had grown up around in a way. And for me, I gravitated towards breast cancer kind of in the academic space, sitting in a classroom very early in my educational career. And I saw a figure that many of us know very well that shows the mortality differences between Black and white women with breast cancer and how we've gotten better at treating breast cancer over time. But Black women and other women of color have not found those same advances. And so many members of my family have gone on to have very rich, robust cancer survivorship experiences. And so I want that to be realized for all. And so that blending of personal experience, seeing the impact that cancer has had on my own family with that encounter in an academic space with this very real inequity that we see in cancer, and really marrying those to move the needle and help make more equitable cancer care for all. And I am interested in making sure that as we get better at treating cancer, that our advances are making it to everyone and that everyone has a high quality of life through their cancer survivorship journey. And I became particularly passionate about metastatic breast cancer survivorship in hearing from patient advocates, starting as simply as on Twitter, hearing the patient voices, highlighting the needs and the gaps that face this particular community around cancer survivorship, and how most of the research that exists, when it does exist, around metastatic breast cancer focuses on end-of-life care rather than understanding that there are individuals living with metastatic breast cancer and thinking about what are the specific survivorship needs for those individuals. And that was really the impetus for this partnership, to work with an organization like Project Life, founded by my wonderful colleague and collaborator, Lesley Glenn, to really understand the patient-centered issues related to metastatic survivorship to broaden the conversation, taking a step back well before we even get to conversations around end-of-life care. What does it look like to live well with metastatic cancer? An analogy that I really like to use for how I see myself as a researcher in this space is that the patients and the patient advocates have the microphone, and through my work, I grab the megaphone to really amplify the needs and what is most important to patients and patient advocates.
Like, it's the first time that someone has ever taken time to really listen, like, what is working for you, what is not working for you, and what do you need. And for so many years, the metastatic voice was not heard. We were like put on the back shelf, and, you know, well, you're going to die anyways, so we don't really need to be funding these types of things. But, for someone like me, that's been living for 10 years with metastatic breast cancer, my quality of life is really very important to me. Like, the side effects. And so what you have done for the community and making their voices known, has been so pivotal for us. And I know it's just a precursor of getting our voices heard to get more research out there to really listen about our survivorship and what's important to us, quality of life. For those clinical researchers that are looking for new treatments to really think about, okay, well, they don't want to be nauseated 24/7. Yes, they want to live longer, but they don't want to be in bed bound the whole time that they are living longer. So having this type of research gives the patient a voice. And so we're able to share that with the clinician part or the scientific part of putting together new treatments, that this is what the community is really wanting and needing. And I feel very strong that they're going to start listening.
So I foundationally believe, as a researcher and as a person, that nobody knows cancer better than people living with cancer. And so that is, to me, the foundational importance of this work, that it is at a very fundamental level elevating the voices of people living with metastatic breast cancer. And so as part of this study, one of the questions that I asked all of the participants was, how would you reimagine metastatic breast cancer care delivery in your own words? Because I believe that the solutions are within the folks who live with these conditions day in and day out, and that it doesn't necessarily have to be a top-down researcher or clinician or what have you approach. It really needs to be a patient-centered approach. And what I learned from asking that fundamental foundational question was so insightful, because I got answers like, I wish I was connected to palliative care earlier. I wish that my oncology team could communicate with non-oncology specialists. I wish I had better mental health support to deal with the depression that I'm experiencing being faced with a stage 4 cancer diagnosis. Those are all things that we should already foundationally be doing for people living with metastatic cancers broadly. And what really struck me is the most quote unquote out of the box answer that I got to that question about how would you reimagine cancer care delivery was, I wish I could be poked less. I wish that I got prodded less when I went to my clinical care visits. And just for me to sit there and think through, literally using the word reimagine, that these are the things that folks come up with, the things that we already know that we should be doing and just need to be doing better. And so that's my hope for this work and the work that it could potentially inspire, that we should be asking all folks living with cancer, metastatic and otherwise, even beyond just metastatic breast cancers, how would you reimagine care delivery? Because your voices absolutely matter. And we as researchers should be listening and elevating those sorts of voices to ensure that we are doing things in a very patient-centered way. And to close that out, it gives me a lot of hope that there are things that we can do, that we have this great foundation of ideas of what patients would like to see be done better about the healthcare system. And so it's really that full range of emotions, honestly, that idea of like, oh my goodness, like these things should be things that we're doing. They should be simple. That's where the discouragement comes in. But also, wow, how fortunate we are as researchers to have such a robust group of patient advocates broadly participating in our scientific conferences, participating in research, giving us such great ideas to make our research even better. To me, success looks like when patients or patient advocates come up to me or come up to Lesley or come up to anyone else involved in this work and say, I see myself in this research, whether or not they're a direct participant or not, that they see themselves reflected in the kind of work that we are doing, that this isn't some kind of abstract idea, that this is really literally that patient-centered work. And that is a different metric of success than kind of our traditional academic norms. For me as a researcher, I want to do work that matters to the folks that are most affected by these issues. And so that's my metric of success. I don't ever want to get to a point where someone asks me, what is the application? What does this mean for patients? I want for folks to be able to see, I see myself in this work. Quality of life is something that deeply matters to individuals living with metastatic cancers, and that I want my value of success is for folks to be able to see themselves centered in research. So I would even take it broader than that. I am a health policy researcher, and so my metric of success is being able to have those sorts of data, have those sorts of publications, have those sorts of presentations that we can take to the Hill, that we can take to decision makers, both big P policy that we talk about in health policy related to legislation, things like that, but also little p organizational policy. And so that is another metric of success, that this work is able to be taken outside of conferences like the San Antonio Breast Cancer Symposium, and it can be used to advocate for greater resources for individuals living with metastatic cancers, greater insurance coverage, to have more robust and holistic support within cancer centers in the physical place of care for metastatic survivorship. That is my metric of success, to see this impact policy both at the large federal, state, legislative, executive level, what have you, but also in the organizational, institutional policy and how we think about metastatic survivorship.
And I think started to get involved in research and just trying to understand what is out there, and also in helping determine funding and through organizations that fund cancer research. So a few of them include the Patient Voice. And as I experienced this, of being in rooms with scientists discussing what is going to be funded, what is important for patients, and sharing my own experience as someone living with cancer, I realized that they don't get to hear that very much. And one, they really need to hear it. And two, they really want to hear it, because they realize that their work becomes so much more impactful when they do take into consideration the experience of people actually living with that disease.
So what is really, really important to me is that, not everybody is going to be a patient advocate. Not everybody is going to have their voice heard. While I'm very passionate about patient advocacy, I didn't start advocacy, when I got cancer. I was always an advocate. I was an advocate before I even got my metastatic breast cancer community for the marginalized communities of where I lived. And so I always wanted to be the voice for those that were voiceless, and I want to continue to do that for as long as I can. We think that cancer could never touch our families, and then we're surprised when they are. But wouldn't it be great if all of these things came together and we could have equitable care, and we could have the right kind of care for survivorship and thrivership, and we wouldn't have to fight for it, that our voices have already been heard, and we've laid that foundation so that we can be sure that those loved ones of ours do not have to go through what we went through to fight for our rights to live well.